Welcome back to Midday Kentucky, everyone. Well, November is Lung Cancer Awareness Month, and according to the American Lung Association, it is the leading cancer killer in both men and women in the US. Here to tell us more about the disease and how it can be treated or prevented is Dr. Erica from Clark Regional Medical Center. Welcome to the show, my friend.
Well, thank you for having me.
Okay, before we get to that where you're saying, you know, treated or prevented, I want to understand what you mean by prevented, because people assume lung cancer with smoking.
Mm-hmm.
So when you say prevented, you just mean don't smoke?
Well, that and many other things.
Okay,
so
explain that for me.
Of course, 80 to 90% of lung cancers are attributed to smoking.
Wow.
Whether you smoke or if you get secondhand exposure. People that have significant secondhand smoke exposure increase the risk of lung cancer by about 20 to 30%.
Are you serious?
Mm-hmm. So we really need to limit our secondhand exposure. The other thing that's important here in the state of Kentucky is radon exposure. So we actually have very high radon levels here, and that's why it's really important to get your house tested.
Dr. Erica, what are some of the symptoms people should look for with lung cancer?
So that's the hard part with lung cancer, is the symptoms are very nonspecific. So things that I always tell my patients to look out for would be if you have a cough that changes, or it's a cough that just really won't go away. If you ever cough up blood, if all of a sudden you start losing weight that you cannot really explain, those are things that should really make you go see your doctor and ask them.
Okay. One thing that's really important, how is lung cancer detected? Now, you were saying loss of weight, but is when you start losing all that weight, is it too late?
It's never too late to know, and the most important way to figure out if you have lung cancer, first step is always having an image done of your lungs.
But
CAT
that's
scan.
something that we don't even think about.
Right.
So should you, as smokers out there, yes, put down the cigarettes, but how often should they be having scanning? And is that type of thing covered by your insurance?
It is. So
it?
there is, several years ago we came out with a lung cancer screening trial that showed that those patients that qualify should have a CAT scan once a year to see if they have the beginning stages of cancer. So those that qualify age 55 to 80, they have to have either be a current smoker or have quit within the last 15 years. They also have to have what we call a 30-pack year smoking history, meaning did they smoke a pack a day for 30 years or 2 packs a day for 15 years.
Wow.
And they have to be willing to undergo treatment if they found out they had lung cancer. So once we get the CAT scan, we may see a nodule in there. A nodule doesn't necessarily always mean cancer. It can be other things. It can be scar tissue. So the only way to truly know is once you find something in that CAT scan, is get a biopsy.
Dr. Erica, what are some of the treatments just that people could expect if they do find out they have lung cancer?
Okay, a lot of it depends on how advanced the cancer is, but usually chemotherapy and radiation are the mainstays of treatment for lung cancer.
Sorry, go on.
I was going to say, if you're lucky enough to catch it early, you can actually have surgery, and sometimes can actually resect it and cure it that way.
You mean cut it out? Okay.
So that's why it's so important to know early if you have lung cancer, because if you catch it early, your chances of survival are much, much better.
It was really interesting that you said to me, covered by insurance, but the conditions are that you have to have been a smoker of 30 years and a pack a day. But yet, if you were a passive smoker, as in someone in the, like I grew up, my mother's smoking like a fish, like a sailor, and in the car, do you know what I mean? And we'd be hoofing that cigarette down our throat like no tomorrow, not even realizing it.
Right.
Do you know what I mean? And I will be honest with you, cigarettes is one of the toughest things to give up. If anyone at home, I still struggle every single day. I think about it.
Right.
You know?
It is very, very difficult to quit, but you can always contact your doctor. There are medicines out there that can help you quit. You know, some people really have trouble with cravings, some people have trouble with withdrawal symptoms, but there is help out there, and it's really important to stop.
Yeah. So I didn't get to the end of my question. If someone is not smoking a pack a day but has been a passive smoker, or maybe smoking 10 a day, would they still be covered for insurance?
So they wouldn't
is that a provider?
Well, they wouldn't qualify for a lung cancer screening CT scan. But once again, if they have other symptoms like the cough I was talking about, the weight loss, those things would get a CAT scan also covered by their insurance.
Dr. Erica, come back.
You're so great.
Thank you.
Such great information. If you want to find out more information about Clark Regional Medical Center, there it all is up on the screen, everyone. And look, even if you just need to give them a call and go in and let them speak to you about giving up smoking, it'll help. and information about radon. I want you to come back and talk about that.